Thank you, Madam Chair. As you mentioned in your opening, telehealth usage exploded during the pandemic because Americans basically, they liked it. They used it. Employers quickly embraced these changes to the healthcare landscape because it was vital for employees' retention. Telehealth alleviated provider shortages, increased access to mental health services, and lowered the cost of care. Departments of Health and Human Services, Labor, and the Treasury saw the benefits to and allowed employers to offer standalone telehealth coverage. This coverage was especially valuable for part-time workers like restaurant industry staff, seasonal employees, retail workers, those who did not qualify for their employer's group health plan. Telehealth is also a valuable tool for underserved and rural communities where access to medical care is a challenge. However, this flexibility that became a lifeline for so many was only temporary. When the COVID-19 public health emergency ended on May 11th, so did standalone telehealth benefits. The Bipartisan Telehealth Benefit Expansion for Workers Act restores this important benefit by allowing employers to offer standalone telehealth coverage, and this amendment, in the nature of a substitute, improves upon already sound policy. In April, we had a legislative hearing to discuss the bill. Some of my Democratic colleagues raised valid concerns during that hearing. The AINS addresses those concerns. The amendment reaffirms that beneficiaries are protected from discrimination against pre-existing conditions and against participants based on health status, and it prohibits plans from rescinding coverage. Additionally, the amendment ensures that employees are notified upfront that these plans are not considered full medical coverage. It also directs the Secretary of Labor to create a model disclosure language, which plans may use to meet the disclosure requirement. Despite what critics may say, nothing in this bill changes an employer's responsibility to offer full medical coverage to their employees in accordance with the Affordable Care Act's employer mandate. That is not what the bill does. Again, this is a bipartisan bill, and I would encourage my colleagues to consider how adding this important option for coverage could help not just workers, but could also be a critical tool for their dependents. For a mother who works long hours in a restaurant, think about how valuable having a 24-hour health benefit could be to her when her child gets sick. For a family who might be dealing with a mental health challenge, think about how comforting it will be to seek counseling from the privacy of their home. If we let these critical telehealth services expire, working Americans across the country will lose access to high-quality, affordable health care coverage. I urge my colleagues to support the AINS and the underlying bipartisan bill, and with that, I yield back.